My name is Nichelle Logan, and I was a part of the second graduating class for Manchester's pharmacy program in 2017. And currently, I am a clinical ambulatory pharmacy specialist for Memorial Healthcare System, which is in South Broward, Florida, so right in between Fort Lauderdale and Miami. And my current position, at my institution, we have 5 hospitals and we have 12 outpatient primary care clinics. So I work with all of the primary care clinics providing disease state management. So we participate in what's called like a value-based care plan model, where we have risk contracts with different insurance plans. And so we have different measures that we have to meet, many of them revolving around either chronic disease state management or just medication, like adherence in general. So I help many of the providers manage their patients who have uncontrolled disease states like diabetes, hypertension, dyslipidemia, post-MI patients, heart failure, and things of that nature.
Very cool. And you have a lot of letters after your name. So we all know PharmD, Doctor of Pharmacy. But can you tell us about these other ones, BCACP and CDCES?
Yes, so I have CPH, which is a consultant pharmacist here in the state of Florida. And then I also have BCACP, so that's a board certification in ambulatory care that I got after completing my second year of residency. And then I also have the CDCES, which is the diabetes educator certification.
Okay, great. So you pretty much never stop just working and accumulating more education, becoming even of a higher expert than the typical pharmacist. Wonderful. So can you tell us, you mentioned residency, so can you tell us a little bit about your journey, I guess through pharmacy school, I guess starting even before that, what got you interested in pharmacy? And then while you were in pharmacy school, what kind of set you on the path of where you are now? And then what steps did you take after graduation to get the position that you have?
Sure. So I was first introduced to pharmacy when I was in high school. I actually worked at CVS as a cashier in the front of the store. And I would always talk to the pharmacist in passing. And then when he had a position open up, he asked me if I'd be willing to do some additional training so that I could become a pharmacy tech. So I did that. And once I kind of got familiar with the pharmacy and just the operation of it all, I really started to like it. And I was a bit of a nerd. I used to read the pamphlets about the drugs and how they worked. So I think it was just fascinating to me, that you could take a pill and it would lower your blood pressure. So I was interested in learning more. And so that was what made me want to go to pharmacy school. And then even throughout pharmacy school, I kind of always had my heart set on doing retail because that was all I knew. And I really wasn't exposed to the different avenues of pharmacy until I was actually at Manchester. And my faculty advisor was Dr. McCafferty, who actually does ambulatory care. And she would always tell me oh, Michelle, I think you'd be really good for this particular, field of pharmacy. And I was just oh no, I just want to do retail. And then it wasn't until my 4th year API rotations, my first rotation was in an anticoagulation clinic. And I really just enjoyed what the pharmacist did and the relationships that he had with his patients. He was able to tell me stories about all of them. And I liked that he had the appointment style set up. And so that was what really struck my interest. So I was a bit of a late bloomer in my decision of going to residency because I didn't decide on it until after I had that rotation. And I was pretty open as far as where I wanted to go. So I think I applied all over the US, honestly. And so my first year of residency, I went to Winchester Medical Center, which is in Winchester, Virginia. And so I did a PGY1 at a community hospital, a 450 bed hospital, and it focused more so on outpatient services, so ambulatory care and transitions of care. And then after that, I completed a PGY2 at Nova Southeastern University here in South Florida. That was in ambulatory care and academia. And then I kind of teetered between if I wanted to do academia or if I wanted to be clinical. So towards the end of my residency, I applied to both positions, and then I ended up going the clinical route. Okay. And my first job out of residency was in Philadelphia at Penn Medicine. So there I was a clinical specialist. I worked in cardiology, dermatology, and rheumatology. And now I'm at my second job again here in South Florida, where I work in the primary care offices doing chronic disease state management.
Really, very cool. What do you think draws you to ambulatory care and that side of pharmacy?
Well, I think, specifically, I didn't mention this before, but I work with a lower income patient population, and I really like working with that more vulnerable group of patients. So I think that was particularly what drove me to my specific job that I have. And I think ambulatory care in general, I just enjoy those disease states. So, the diabetes, the heart failure, that type of stuff. And I like the setting. Again, I like being able to have appointments with my patients. All of my patients, I can tell you like personal stories about them, and I have personal relationships with them. So that was very important to me. So I felt like this particular environment allowed me to have all those things.
Very cool. And I don't think there's a better walking message of what Manchester's, what everything is Manchester is about when we think of our mission and our mission statement and reaching individuals, from all walks of life and individuals who are most vulnerable, like you said, and being the one who's an advocate for them. So I think that's amazing. What was your favorite class in pharmacy school?
So I would say my favorite class was probably the cardiology modules. Just those kind of fall in line with what I do now. So I think those were the most enjoyable to me. And even more specifically than that, I think just in general, I really enjoyed the classes where we learned about pathophysiology. I've learned that if you really understand the disease and like how it manifests in the body, that makes learning the medications a lot more easier. So I really enjoyed those classes. Very
cool. You're obviously a very talented individual, so you could have done many different things. What drew you to Manchester? Why did you choose Manchester for your doctor of pharmacy degree?
So I would say the fact that it was newer, I think was the biggest thing, because I knew that would really give me the opportunity to kind of help set the roots and help, I was helping with bringing a lot of different organizations to the school. So a lot of those leadership opportunities that I wouldn't have really gotten elsewhere, I was able to get in Manchester. So that was what drew me to being there.
Very cool. Yeah, and we're still looking for those individuals. We love those that want to come and do something new and to take charge. And we're still like that. So even though we still have we've graduated a few classes now. I think a lot of us are still in that mindset of we love people that want to come and do new things and just take their reins and grab opportunity. So really cool. This has been awesome. This has been amazing to hear where you're at now in your journey and the great things that you're doing. Anything else to share with us? Any future plans? Do you think you kind of know where you want to be? Are you good where you are? Anything else in mind?
I don't really have anything in the pipelines right now. And as far as I've moved around quite a bit, so between like residencies and different positions that I've had, so the plan is to stay settled here for at least a while anyway.
Okay. Well, I know you mentioned academia before, so if you're ever interested, keep us in the back of your mind. We'd love you to come rejoin us in a different role.